We want to get to the real root cause. So that's why I call it that. And we're going to talk about how to finally stop chasing symptoms and finally recover by addressing immune dysregulation and regulating your immune system. All right. So let me ask you some things. I'm curious if this list of symptoms and experiences resonates with you. I know it does with most of my patients. So if you are someone who is not just dealing with fatigue, but like you're dealing with debilitating fatigue, right? Like it is interfering with your daily activities. Every day you have to take a nap. It is difficult to parent your child or go to work. And you're literally the definition of chronic fatigue. You are in the right spot. If you're dealing with food sensitivities, so many people come here after having tried all kinds of elimination diets, and some of you are still doing the elimination diet because it kind of works temporarily. Like as long as you don't eat all these foods, you feel fine or you feel better. But the moment you eat them, you feel terrible again. We're going to talk about that's not a real solution, and it's actually a symptom, not a root cause solution. Brain fog, debilitating brain fog that's interfering with your work. Maybe it's difficult to recall words. Maybe you're very forgetful and it's almost concerning, right? We're going to talk about it. GI symptoms from bloating to irregularities to cramping to burping to just bad digestion, right? All the symptoms, heartburn, reflux, recovering it. And then there's anxiety. Anxiety is, believe it or not, a very common symptom that many of my patients experience. It's not rare. It's in fact one of the more common symptoms that I see. And maybe you're dealing with depression, focus, ADD issues, OCD. We're going to talk about the root of these brain-based symptoms. And if you've ever been told that your labs are normal, but you know you're not normal, that you don't feel well, that something's going on, you are in the right place. There's a reason for that. I've experienced that myself. And we're going to dive into how that could possibly be. Why could you have normal labs and still feel terrible? So here's why we can't say the body is broken. Because the truth is, and I've been doing this for a long time, the body is amazing. Even when you feel terrible, your body is always doing the right thing at the right time. It's doing its absolute best to heal you and to respond appropriately to what's being thrown at it. And that doesn't always feel good, but it's an appropriate response. And it's kind of like a fever when you're sick, right? When you're sick and you get a fever, it doesn't feel fun to have the fever. The symptoms that come along with acute illness aren't fun, but they're necessary to fight the infection, to fight the pathogen. And it's so interesting because most of the red flags and the signals and the alarms that our body gives us in conventional medicine, we're told to actually cover that up and just quiet the alarm rather than taking it for the information that it is and addressing it. Your body's giving you signs. Your body isn't broken. There's always hope. There's a reason for everything that you're feeling. It really is about finally getting to that deep level root cause. No more tiptoeing around the symptoms. That's what we're going to do today. And the answer isn't you need to detox harder, or you need to cut out more foods, or just manage your symptoms better. These are all symptom chasers. We need to go deeper. And deep inside, you know that too. I think for most people that come to see me, they typically have done all the things. They've been to the conventional doctors, hit roadblocks. They've been to functional practitioners and hit roadblocks there. They've done all of the dietary changes. They've done the heavy metal and parasite and mold detoxes, and they've done all the things, right? And they still feel terrible, or those things just kind of offer temporary relief. It's because it really isn't going deep enough. We have to get to the actual thing that's causing your problems and the deepest level of root cause. What you're going to learn today, you're going to learn why the immune system is at the center of chronic symptoms. This is the missing link. This is the piece that people are overlooking. We're going to talk about what conventional, even functional medicine often misses. And we're going to talk about the step-by-step method to finally get results that last. So why you should stay. At the end, I'm going to, we'll be sharing a symptom decoder. Believe it or not, your symptoms, your health history are the most valuable clues that you can ever have. They're more valuable oftentimes than even testing can be. What we'll talk about is that pathogens are predictable, right? So pathogens, chronic infections, they are very predictable with the way that they present themselves. And oftentimes within 5 minutes of speaking with somebody, after I understand their symptoms, when and how they started, what their health history is, I'm able to determine pretty accurately, even prior to testing, what the root cause is. And so I developed a symptom decoder to kind of help people evaluate their symptoms in that way. We're going to be talking about an action plan of next steps and what it actually looks like and takes to get better. So I have two simple questions for you. True or false, food is the problem? And I kind of already hinted to it a little bit already. The answer is false. Food reactions are symptoms, not causes. And I think more and more people are becoming aware of this now. Like 10 years ago, elimination diets were all the rage, right? Like basically functional medicine was food sensitivity testing and elimination diets. That's basically what functional medicine was back then. And I always said, like, no, this is not the root cause. This is just tiptoeing around the problem. Because I'm sure you've asked yourself, like, why can I not eat gluten, dairy, and sugar? Because 15 years ago I could and I was fine. My husband can eat it and he's fine. My kids can eat it and they're fine. So why can't I eat it? And the reason isn't because dairy, gluten, and sugar are the problem. What dairy, gluten, sugar are doing is triggering the problem that's inside of you, which is your immune system, right? It's really an immune response to food that's the problem. And so we want to fix that. We don't want to just identify the foods that your body doesn't like. We want to fix why your body doesn't like them so that you can then enjoy these foods in moderation, right? I always like to say I'm not advocating for eating poorly. I definitely think most of the time you should be eating healthy, but it is definitely a red flag if there's foods that you have to avoid because of the way that they make you feel. There is something deeper there that we need to uncover. True or false, normal labs means you're healthy. The answer is false. You can feel terrible even when labs look normal because standard tests don't measure immune resilience. It doesn't measure stealth reactivations. It doesn't measure chronic infections. And these are the things that tend to be at the root of most people's chronic symptoms and mystery illness and mystery symptoms. And these are just not things that conventional doctors look at. And so you can absolutely have autoimmune markers that look normal, CBC, metabolic counts that look normal, and yet you have chronic viral load. You have lots of reactivated pathogens, whether that be in your intestines or systemically. And all of that could be driving inflammatory response in the body. And B standard tests would never pick that up and you would never know. So that's why your labs can look normal, but you feel anything but. A little bit about my personal story. I do this because I walked this journey. I was chronically sick myself, and it happened after the birth of my second daughter. Emmy is almost 12 now, so it's been nearly 12 years since that happened. And after Emmy was born, I had a severe crash. At the time, was operating a very busy chiropractic clinic. I am a chiropractor. That is what my doctorate is in. And so back in the day, 15 years ago, that's what I was doing. And after Emmy was born, it was like immediate and severe to the point that I couldn't work any longer. We had to hire another doctor to take over my clinic. And suddenly I was left trying to figure out what in the world happened, what was wrong with me. I was bedridden, there was fatigue, there was pain. There was digestive issues and food intolerances and just unexplained symptoms that didn't make any sense. And I tried all the things, right? I hit the roadblocks too. I went to conventional doctors and they said it was my thyroid. They gave me medication that did nothing. I went to holistic colleagues and functional medicine colleagues, and they gave me things that made a little bit of sense and it helped a little bit, but it still never really got to the root cause. So a few of the things that I tried, you may resonate with some of this. So number one, I was on very much a strict diet. I mean, again, if I had any amount of sugar, oh my gosh, I would be in bed for days. Gluten, grains, couldn't eat any of that. Dairy, really couldn't tolerate that either. And so my diet was very strict. And I did tons of detoxes again 10 years ago, or actually longer than that, more like 12 years ago. Really, functional medicine was food elimination, and it was heavy metal detoxing and maybe some mold detoxing, parasite cleansing. I was told, you know, it's MTHFR. And so I did all of these things. And I'm not saying that those things didn't help. They did. I was able to regain function and operate in my daily life, but I had to maintain a very strict regimen. And if I deviated away from it, I felt terrible. One of the things that I did was coffee enemas. And if you're not familiar with these, it's a detox that helps your liver produce bile. And for me, what it did was it cleared my brain fog for about 2 to 3 hours at a time. And so I would do 3 a day. I would do a coffee enema in the morning. I would adjust my patients, come home at lunch, do another one, go adjust my patients, come home, do another one. So I could be a wife and a mom. And it was just what I did because I had to. I was in survival mode. And it was really like one of the only things that worked and cleared my brain fog. And so I just relied on it. And I was, at the time, I just felt grateful that I found something that helped. And in my mind back then, that's what functional medicine was, right? And so I did saunas, I had an infrared sauna, and just tons of supplements. I mean, crazy amounts of supplements that I was just popping all day long to try to just be functional. But the reality is I was still sick, and I knew deep down that this really hadn't solved my problem. So I did have a breakthrough, and a couple of breakthroughs. My first breakthrough was as I was packing for a trip, and I was packing up my coffee enema stuff and all my supplements, and I was Googling where all the Whole Foods were. Back then, Whole Foods weren't everywhere. So I would have to like really plan to go find a Whole Foods wherever we were traveling to. It was just ridiculous. I just remember thinking, this is ridiculous. Like, I cannot believe this is my life, that I have to do all of this, just not even, I would say, to feel good, but just to be operational. And it kind of just dawned on me, like, this is like, I have missed something here. This is no way to live. This is not sustainable. I need to get to the root cause. At the time, I was taking some functional immunology classes. I knew just innately, I knew that the immune system had something to do with this. And another breakthrough that I had was at a functional medicine seminar. They had vendors. They had vendors in all of their supplements. And during the breaks, you could go around and talk to the vendors and take supplements. And I remember at that time, too, I especially felt so awful. And so I would just go around popping all the supplements, hoping and praying maybe one of them would do something that would help. And I remember taking this one supplement. It was an antiviral supplement. And about 20 minutes after I took it, I had this intense burning symptom in my intestines, right? Burning in my intestines. And shortly after that, all of my chronic symptoms disappeared. The brain fog lifted, the pain in my neck, the pain in my shoulder blade, the headache, the earache, the throat congestion, the sort, like all at once, everything disappeared. And I remember thinking, oh my gosh, I've found the solution to my problems. I'll just take this supplement every day for the rest of my life. And I feel so thankful. But unfortunately, a few hours after taking it, the symptoms slowly started to come back. And even after taking more and more and more of that supplement, it never went away again. And so what I determined and realized from that is that I did have some sort of a chronic pathogen load, right? That's why I responded in that way. But because it was a killing strategy, it didn't last. It was temporary. And we'll talk about why that is. And that's why I had temporary relief that never came back, is because I did have chronic pathogens and that offered a temporary relief, but I still hadn't gotten to the root cause. And what I eventually realized and learned is that the true solution to dealing with chronic pathogens is to regulate your immune system towards the pathogen, not try to chase it and kill it. That's not a lasting result. We have an immune system that's designed to fight these pathogens. And so if it's not, that's where you need to look. We don't want to chase pathogens. We want to go to the defender of the body, the immune system. This is what's supposed to defend against the pathogens. And that's the broken part, right? And so once I realized that, that's when things started to take a turn. It started to make sense to me as I was learning more about reactivated Epstein-Barr virus at the time. I had a severe bout of mono when I was in junior high. And of course, Epstein-Barr is what causes mono. And so I got tested, it confirmed it. And so then I began to realize, like, okay, reactivated EBV is definitely a part of the equation for me. And then later I began to learn that there were other chronic pathogens involved as well. So what's really going on? This is the slide you need to take note of, right? Of like all the slides, this is the one that I hope that you understand, because this is why, this is the explanation as to why your body is behaving the way that it's behaving and responding the way that it's responding. So when we think about the immune system, most people think it's this one thing that just like fights for us. And while we do have one arm of the immune system that kills and fights, it's called the Th1 killer response. We also have another arm of our immune system called the Th2 antibody response. And this side is what remembers and identifies enemies in our environment. And what we really want is balance between the two sides of the immune system. And when it's balanced, we have immune tolerance and immune harmony. And our immune system works in harmony together to defend and remember equally. The problem is when there is a dysregulation. When the two sides become imbalanced, that's when we see chronic problems happening. So one of the things that happens, and we'll talk about some of the triggers that cause this to occur, but when the immune system does become dysregulated, we're going to see a weakening of the killing side. So the killing side can't defend and keep pathogens at bay anymore. And then we're also going to see an overreaction on the Th2 side. And so this is where we see allergic response and food sensitivities and just a hyper immune response to our environment. That's the Th2 side. And so for most people, there's a lot of times a combination going on, but it's all stemming from the immune response. This is also what drives inflammation. So what triggers the immune system to misfire? Let's talk about this. First of all, acute infections and viruses like COVID, for instance, right? How many people got COVID and then they've never been the same since? And we call it long haulers syndrome, but really what it is COVID triggered an immune response. And now you're experiencing symptoms from reactivated infections. But this can happen with any acute infection. It could be a random bug, viral bug. It could be mono. It could be strep throat. It could be pneumonia. It could be, food poisoning. Many people will say I was never the same after this event occurred. And it's because it disrupted that balance in the immune system. Mold, right? Everybody's talking about mold, and mold's an issue, right? I don't advocate living in mold. I think you should get out of there. And I think you should resolve the mold in your house. But if you think that the solution to an exposure to mold is like detoxing the mold out of you, you're kind of missing really what's going on. Mold is an immune trigger. Mold triggers the Th2 side of the immune system, which is the side that also deals with fungus. And so when we're in mold, what happens is Th2 ramps up to deal with the mold in the environment. But even after you leave the environment, the immune system stays in this dysregulated, heightened state. And until you deal with that and regulate your immune system, it doesn't matter how much you detox mold or how much you get the mold out of the house. In most cases, you're still dealing with that immune response that needs to be dealt with. Stress and trauma. I don't have to convince anybody of this. Stress weakens your immune system. In fact, there are many studies showing that children who've experienced childhood trauma have more predisposition to autoimmunity, to cancer, to health problems later in life. The reason is because it's really clear. Emotional stressors weaken the Th1 side of the immune system. But also physical stressors can do it as well, right? Surgeries, injuries, sometimes these can be a triggering event. Pregnancy and hormonal shifts. Our body is amazing. It's always doing the right thing at the right time. And in pregnancy, our immune system shifts by design. It actually weakens the Th1 response so that it doesn't kill or terminate the pregnancy. And that's what it's supposed to do. But for many women, if you entered into pregnancy in a weakened state already, then it becomes the trigger that your immune system just can't recover from. And then from that point forward, after pregnancy, you have all these symptoms, you never feel the same. Maybe you start getting diagnosed with autoimmune disorders. And the reason is because it triggered that dysregulation. Sometimes at menstrual cycles, shifting in the menstrual cycle, people will notice during my menstrual cycle, my symptoms are worse. And they think it's a hormonal problem. No, it's not a hormonal problem. Your menstrual cycle, when hormones shift around that time, it again further exacerbates that immune dysregulation. And so you feel that the symptoms get louder from the pathogens, they get louder. But the hormones aren't the solution. That's just a trigger. Antibiotics kill. They lower a pathogen burden temporarily, and they weaken that Th1 immune response. And so that can often be antibiotic after antibiotic. It's just this chronic weakening of that Th1 killing side of the immune system, and can be the trigger that starts to cause other problems. So when I talk about reactivated infections, just to be clear, what I'm saying is, and I always use this as an example, is chickenpox and shingles. This is a great example of, you could have had chickenpox when you were 5, but once you have it, that virus is in your body and it will never leave. It's there to stay. There's no killing it. You can't get rid of it. It's there. We all have pathogens in our body. But as long as our immune system handles it, it doesn't matter. It's totally fine because our immune system handles that pathogen in our body. But for people whose immune system is not doing that, then they're going to get shingles later in life, typically under stress and things like that. Another great example is going to be herpes simplex virus 1. This is what causes cold sores. Again, most people know once herpes is in your body, can't get rid of it. It's there to stay. But as long as your immune system regulates the pathogen, it's not a problem. But most people will say when they're under stress, when they get sick, they get a cold sore. Why is that? It's because the immune system isn't regulating it as well during those moments. So if herpes can do that, if shingles can do that, imagine what other pathogens can do when they reemerge and when they reactivate. So the cool thing is that these pathogens, they're predictable. They look a certain way when they reactivate. Shingles always looks like shingles. Herpes always looks like a cold sore, right? All of these pathogens present in a certain way based on where they harbor in the body and the mechanism that they have within the body. So we're going to go through some of the most common pathogens that I see in practice behind people's chronic symptoms. Number 1 is streptococcus. How many people had strep throat, ear infections, sinus infections? All of that is caused by strep. And once strep is in the body, it can reactivate. It can get louder when your immune system weakens. And some of the most common places that strep harbors is going to be in the sinus cavity, the ENT. So if you have chronic ENT issues, it's all over our skin. So any type of skin or hair issue, it is in the intestines as well. So we can see IBS. Strep was recently linked in research to Crohn's disease. Super interesting study that found that people who had recently been diagnosed with Crohn's had also recently had strep throat. Isn't that interesting? And that's clinically what I found in my practice as well, is before that study ever came out, I would see a correlation of, oh, really? You just got diagnosed with Crohn's and 6 months prior, you had a really bad bout of strep throat. It's a correlation there. Anxiety and OCD. PANDAS is becoming very well known these days. It stands for pediatric autoimmune neuropsychiatric disorder associated with streptococcus. Right after strep throat, children change overnight, and all of a sudden they have anger and anxiety and OCD and tics and various changes. And even conventional medicine now recognizes that this is the case, that it's being caused by strep. But imagine if strep can do that. What else can strep do? What can strep do in adults? This isn't just something that only happens to kids. This can happen to adults too. UTIs, interstitial cystitis, streptococcus bacteria is in the urinary cavity. It's in harbors in the urinary system and tends to be a major pathogen for those symptoms. This is something that's going to be missed unless it's an active throat infection your doctor is never going to tell you that chronic reactivated strep is what's causing your UTIs or your chronic sinus issues or your skin problems. I also want to add that strep is very much connected to psoriasis. Conventional medicine does know this. There's tons of research confirming it. And honestly, you guys, there's so many other things that strep is tied to in research. Epstein-Barr virus. So first thing I want to mention is that EBV is not the only culprit behind mono. Cytomegalovirus is also involved, and that's also a viral infection that causes mono. So if you've only been tested for Epstein-Barr, maybe your problem's cytomegalovirus. Maybe it's not Epstein-Barr, maybe your mono was cytomegalovirus. Maybe you have both. That's one of the reasons that testing can be important. Other thing to keep in mind is EBV is very common. Most people have been exposed to EBV, but the level of exposure, and this is where testing comes into play, tells us likelihood of reactivation. And so while yes, most of us have been exposed, if you have immune dysregulation, your immune system isn't going to handle that viral load. That's the difference. And that's where we test, not just for the pathogens, but understanding the immune system better. EBV can look like cycles of crushing fatigue. It can be diffuse body pain. So Lyme can be more localized and joint pain. EBV tends to be body aches, diffuse pain, swollen glands. You can flare after emotional stressors. EBV can harbor in the nervous system. Very much linked to thyroid problems, very much linked to Hashimoto's, very much linked to hormonal shifting. And then there's Lyme. Lyme disease isn't rare. It's not just a disease for the celebrities. It's a pretty common bacterial infection. It has co-infections like Babesia, Bartonella, Mycoplasma. It's probably one of the top co-infections that I see of Lyme. And it can cause, again, migrating joint pain, neurological symptoms, migraines, and it can flare with mold exposure, with weather shifts, with EMF exposure. So these would be some of the signs. It's not just a tick-borne pathogen. So, you know, tick can be one vector, but there are many other vectors. This is a bacteria. So there are certainly many vectors of exposure with Lyme and Lyme co-infections. H. pylori, another major pathogen, very disruptive. And conventional doctors are aware of this, but their testing's really terrible. It misses it most of the time. H. pylori can look like bloating, reflux, heartburn, food intolerance, nutrition deficiencies, nutrient deficiencies. So if you have symptoms of B vitamin deficiencies, if you got classic symptoms of iron deficiency, that's where you should be looking, is H. pylori, because it weakens stomach acid, and then it has a downstream effect on the gut and the immune system. It's oftentimes a precursor to many, many other issues. It's often the hidden root of histamine problems, insomnia, also skin flares. H. pylori can wreak a lot of havoc. And again, testing isn't always accurate. What people say is normal H. pylori load is not always the normal load. And this is where clinical observation, clinical reading of the testing really comes into play. And I'll talk about that here in a second too. So why testing sometimes misses the real problem. So most tests give a snapshot, not a pattern. And it's so important. I would say one of the most important things that I do with a patient is I listen to their health story, their symptoms, their health history, what triggered their problems. This is what tells me where we should look. And while we always take into consideration testing, we don't fully ever rely on it, right? Because there's no test that's completely 100% accurate. So we have to have a pattern recognition. The story has to make sense. It has to line up. And misinterpretation oftentimes leads people down the wrong path, right? So many people now more than ever, they're doing stool tests, GI map tests. It's a great test. It's still not perfect. And sometimes they'll say things like, oh, you know, my GI map test says I have parasites, so I did a parasite cleanse, but I still don't feel good. And again, if you don't have a strategy behind the lab interpretation, you could never have a parasite problem without a stomach acid problem. You can never have a parasite problem without a Th1 disruption problem, right? So parasites tend to be a symptom of much deeper issues. And if you just focus on that, you're Again, you're just symptom managing. So these are the types of things, right, that we need a strategy involved in the interpretation of the testing, rather than just like, that's high, so it's a problem, that's low, so it's not a problem. It's not always quite as simple as that. So the real value in the test, and I always tell people that, it's the strategy behind it. It's not the test itself, right? It's the practitioner's clinical interpretation of it, right? It's me having walked 2,000 people through a GI map test and through these protocols, and all the things that I've learned in that time period. That's the value, because these tests aren't always perfect. And oftentimes there's patterns involved, and you have to know those patterns, that this pathogen tends to go with this pathogen. This pathogen tends to cause this disruption, right? So when immune regulation fails, then things like hormone chaos, gut dysfunction, fatigue, mood shifts can happen. So a couple of things I always like to share is that, you go to your doctor, you get an autoimmune diagnosis, and you say, hey, what caused this? And they say, we don't know. It just happens. But it's funny, right? Because we do know. We know very clearly what causes autoimmunity, and it is a shift in Th1 and Th2, which then triggers Th17, and Th17 is what causes autoimmunity, right? This is what causes inflammation. Th2 is the pro-inflammatory side of the immune system. You cannot have an inflammatory problem without an immune problem. That's what's driving it. Because when you think about it, like if you were to get cut on your arm, what's going to happen? Inflammation, right? It's going to turn red. It's going to swell. It's your body trying to heal you. So the same thing happens inside the body. If you have these chronic pathogens, chronic viral load, your body is going to go into a state of inflammatory response to help you, because inflammation is actually what helps to heal the body. So if you have chronic inflammation, it's because there's something inside your body is trying to heal. Your immune system is trying to heal it. Hormones, right? Hormones aren't root causes. They're downstream. They're affected by everything that's more deeply going on. And gut dysfunction, we always say, oh, health starts in the gut. And I kind of, yes, in a way, that's true. But I think what's more accurate is health starts in the immune system, right? And so often people say we got to fix the gut because the immune system, 70% of the immune system's in the gut. But doesn't it make more sense that we need to fix the immune system to heal the gut? Because most of what goes wrong in the gut are chronic infections. So if we had an immune system that could handle infections, well, then we wouldn't have any problems in our gut. So the deepest level of root cause is your immune system. And this is what can lead to these chronic symptoms, because these chronic pathogens just take over and start driving all of what seem to be like mystery symptoms. I want to share my strategy. My proven 3-step healing framework is to drain, regulate, and restore. And so this is what I discovered over time is what helps me to get a reproducible and reliable result with people. And there's a reason for the way that we do what we do. So we'll start here with step 1, opening drainage pathways. So the way I like to describe it is, if you had a fire in your house, and let's say you had a low-grade fire in your house for 20 years, first thing you want to do is open up all the doors and windows to let 20 years of smoke out. You don't really want to start putting the fire out until you've opened the pathways up. And that's what drainage is, right? It's making sure that the liver and the lymph and the intestines, the skin, the kidneys, that there's pathways of elimination that your body can eliminate properly. So we always start there before we dive into the deeper things. And step 2 is where we calm the fire. We address the immune dysfunction with microdose pathogen therapy. So when we discover that these pathogens are really what are behind our symptoms, and we confirm it in testing, right? Then the solution isn't to kill. The solution is to retrain. And so it's a very similar concept to allergy shots, right? So with allergy shots, you'll get injected with whatever you're allergic to in small doses over time, and it builds immune tolerance. Basically, it teaches your immune system that if I give it small doses of what it's not tolerating, over time, it will tolerate it. And so this is doing the same thing. The problem isn't the pathogen. The problem is your immune system isn't recognizing or tolerating the pathogen. So, but giving small diluted, deactivated dilutions of the pathogen in homeopathic diluted form, right? It teaches the immune system to regulate it over time. And it has a far different effect than a killing strategy would. And so this is what allows us to silence the pathogens and their symptoms, but also restore that overall immune balance that we're looking for and restore that immune tolerance that we're looking for. Step 3, we build resilience. And so this is kind of like more of the classic functional medicine stuff where we're going to build up the mitochondria. We're going to make sure that nutrients are not depleted. We're going to support the nervous system and kind of have that long-term regulation. This is the part that I always describe as like, this is where we clean up the house and repaint the walls, right? We open up the windows, we put the fire out, and then we do the restoration part of the house. And so often in functional medicine, we skip the first 2 steps and we go straight to the 3rd step, right? So we have closed windows, we have a low-grade flat fire in our house, and yet we're repainting the walls and we're sweeping up and dusting, but we still haven't addressed those deeper root issues. So again, with this process, we're not killing, we're retraining the immune system. And again, like I talked about the fire in the house analogy, this is what builds that long-term restoration. So why it worked for patients when nothing else did, it's again, because we're not chasing symptoms. We're not saying, oh, you have headaches, or oh, you have nutrient deficiency. Here's B vitamins, here's iron. When really we should be asking, why do you have nutrient deficiencies? What's causing that? Is it because you have H. pylori and it's disrupted your stomach acid and now you can't absorb those nutrients? Maybe we should look there, right? Instead of giving you something for the headaches, we're saying why, what's causing it? What's driving that in the body? And so we also don't chase the pathogen with a killing strategy. Kind of the way that I describe it is, if you were to have an allergy to cedar trees, and if your strategy was, I'm just going to cut down all the cedar trees in my backyard, well, the moment they grow back and the moment you go to your neighbor's house, you're going to have a problem again. So really what we want to do is just get your immune system to tolerate it, right? The problem isn't the pathogen. The problem's your immune system not tolerating the pathogen. So it's a very, very different approach. And it's why I use it. It works incredibly well, and it is very different. And so for people who've tried everything else, this is the missing piece that helps them get the results they've been looking for. Here is a patient of mine, Selena. She came to see me with acne rosacea, chronic fatigue, and those were her 2 primarily her issues that she was concerned about. But interestingly enough, there were many other symptoms she was experiencing, but she kind of just wrote them off as like, oh, that, I just deal with those. She had a lot of food sensitivities. There's all kinds of foods she couldn't eat. And she just kind of was like, well, but I manage those pretty well. And so one of the things that I do with my patients is I actually ask for you to give me a wish list of symptoms. And I always say, if I could wave a magic wand and get rid of 10 symptoms, what would you want those to be? I don't want just the top 2 to 3 that you're here for. I want the other things that don't even bother you, that maybe you're just like, I don't even care about those. And so that could look like canker sores. It could look like you get styes on your eyes. It could look like I've had this rough patch on my heel for 20 years and it never goes away. I have this rash that always pops up on my elbow and I don't know why. And these are things that, of course, like you're not going to come to see me for as a concern, but they're still clues and they're still associated with the root cause problem. And so the cool thing is that as we address the root cause, we don't just see your top symptoms resolving, we see the secondary and the tertiary symptoms resolving as well. The things that you've probably just brushed off as like not a big deal. So that's the same thing that happened with Selena. It was like very visible. Her skin got so much better really early on into the treatment, but we also saw all of these other things resolving as well. With her health history, she had a health history of sinus infections, shingles. She tried everything. She'd gone to all of the skin doctors, conventional, functional. She truly had tried so many practitioners. This was what fixed the problem for her. We found with her H. pylori and streptococcus, which makes sense. H. pylori is very much connected to rosacea. Strep is very much connected to acne. And so we saw all of these symptoms resolving with the treatment. Lisa's story. Lisa was bedridden. She was housebound, terrified, and misdiagnosed. And within 6 months of treatment, she could drive again. And Dr. Stanga, she says, Dr. Stanga saved me when no one else could. And for Lisa, she primarily was dealing with Lyme. And it was pretty severe. And again, she'd gone everywhere. Nobody could tell her what was going on. She had a long list of symptoms. And they all seemed to her to not be related, but they were very much related back to these chronic pathogens. One of the things that Lisa also mentions is Mark. And Mark gets mentioned a lot in our testimonials. He gets shout outs. And Mark is my husband, by the way. Mark is our practice administrator. He runs the practice with me. And people love talking to Mark because Mark has gone through this process himself. So he very much has perspective on it. And he has a way of talking about what we do in the therapy in a way that is sometimes more relatable, right? He doesn't always use all the doctor terms. And so people really love speaking with Mark and getting their questions answered by him. Mark's an extrovert. I'm an introvert. He's an extrovert. He loves to chat. So step-by-step process. This is what it looks like when you come to see me, right? So there is a step-by-step process. The first step is discovery. And this is where I talk about it. So crucial. I have to understand your history and your symptoms. Sometimes people, they're like, hey, here's my test. Can you just read them for me? And I'm like, no, I'm not just a blanket lab reader. I need to talk to you. I need to understand, what are we dealing with here? What are your symptoms? What are your secondary symptoms? What are your tertiary symptoms? What triggered all of this? How long has it been going on? What infections have you had in your past? What infections tend to pop up over time? That tells me that you have a predisposition to that pathogen. These are all the things that I need to know to gain perspective on the test that I'm about to read and look at. And then with the testing, we want to make sure the right testing is done, right? So people will be like, well, I have a mold test and I have a heavy metal test. And I'm like, great. It doesn't sound like in any capacity that mold or heavy metals are your problem. It sounds like Epstein-Barr and H. pylori and strep are your problem, and you didn't test for that. So unfortunately, I know you spent money on it, but these tests aren't helpful. The reality is that at any given time, if you do a mold test, even healthy people are going to show high mold. At any given time, if you do a heavy metal test, even healthy people are going to show high metal levels, right? Just because it's high doesn't mean it's the source of your problems. And again, this is where interpretation comes into play. The story has to make sense. So that is why I know you've run the tests, but if they're not the right tests, it's going to make it hard for me to help you. I need the right tests if you want me to help you. Immune therapy. After we get through the testing, after I understand what's going on, after we do a clinical deep dive and I present the protocol and this is what I recommend, then we dive into the treatment itself. And this is where we're going through a several-month process of taking these dilutions of the immune therapy, the pathogen microdosing. Again, it's using homeopathic dilutions of the pathogens that are the very specific strains of the pathogen you're dealing with to retrain the immune system. And we slowly increase the dosing over time to achieve the result that we're looking for. And through the process, I'm tracking and I'm supporting, right? So this isn't just like me throwing some supplements at you and, saying, have fun, right? There's going to be some tracking involved. I have to understand how to take you through it, when to increase dosing, when to slow it down, all of these things, right? So this is something that I hold your hand through this process. You're not like, on your own. That really is what the step-by-step process looks like. What immune therapy really does, again, it really is this teaching your own body to do its job. What's really incredible about this homeopathic therapy is that it's not forcing your body to do anything. It's gently giving it information to do a better job. right? Your body's not doing the right job with these pathogens. And so by doing the pathogen microdosing over time, it gently gets your immune system to go do its job. And so again, it works like allergy shots, but for pathogens. It's building internal immune tolerance versus external immune tolerance. So how we determine your root causes. Well, first, it starts with a new patient consult. As I've stated, like your story matters. It's so important. It's the most important part of the whole process. And then we do strategic testing. I tend to use blood and stool testing. And these are the things that give me the most information typically on what we're looking for. So the blood testing is usually geared towards titers, immune titers. It's geared towards different, we do a CBC and metabolic panel, but I interpret it in a functional way. We're looking at key immune markers. We're also looking at markers that can tell me anything about subclinical deficiencies, meaning that your body is showing signs that you have a deficiency before it becomes an overt deficiency. Stool testing, we're going to be able to pick up pathogen loads in the intestines. And so these become some of the main tests that I use. Like we've talked about, not all tests are created equal. You need the right ones. Even stool testing, I've tried them all. There's some out there that are they're just not very accurate, right? And so even if you've had another kind done, it's like, if you want the best result, we really have to do the one that's going to give us the best information. I always say I treat people, not paper, right? That's what medical doctors do. Not to bash medical doctors. They're doing the best that they can, and there's an obvious place for them, right? And we need them. But when it comes to chronic problems, that's where we hit roadblocks. And the reason is because they are treating people, not paper, right? They spend 5 minutes talking to you. They don't know what your story is, what led up to these symptoms. And so if they run a test and it comes back, everything's good, then they say everything's good. And if they find something that doesn't make sense, right, or is abnormal, then they're going to say, this is your problem, even if it doesn't make sense with your story. And so that's what I always say is I treat a person holistically, not sheets of paper, right? The story has to make sense. This approach is for you if you want real answers that make sense. So that's what I always say, like, you can get answers, but are they answers that make sense? Right? If somebody's like, oh, your problem is heavy metals, it's like, okay, well, make that make sense for me. Like, all of my problems started right after pregnancy, right after, like, so did the metals just all of a sudden, like, how did I get these metals, right? Tell me a story that makes sense. And so again, I'm not saying that toxic burden and toxic load doesn't contribute to weakening the immune system. But if our full focus is on the trigger and we miss the root cause, you're not going to get the best result. This approach is for you if you want to plan, not more guesswork. So many people are out there, right? You're Googling like crazy, just trying to figure it out. And if you're tired of doing that, then this approach is for you, right? I've done this many times. I've also spent the time doing that. And so this is for you if you're wanting a plan and you don't want to guess anymore and stop Googling at 2 a.m. You want to feel like yourself again, right? And for many people, they don't even know it. Most people don't even know how good you're supposed to feel. I have found most people don't even know how good they're supposed to feel because most people have been living with these chronic pathogen loads for most of their life. If you think about it, like if you were a kid who had strep throat and ear infections all the time, you probably have never really experienced complete and utter health, right? You've probably always had low-grade symptoms that you just believe are normal. So most people sometimes don't even know how good they're supposed to feel. Testing isn't enough without clinical pattern reading. So again, CBC, GI map, and titers only help when They're matched to symptoms. They're matched to a story. We look at holistically. We look at what pathogens tend to go together. We look at what pathogens disrupt the CBC. Like we look at all of these things, right? And then we make a determination of strategically what makes the most sense to address. Data is useless without context and clinical interpretation. So what immune therapy really does, again, it's microdose-based immune retraining. It's gentle stimulation, not harsh detox. It's like allergy shots, but for viruses, bacteria, and stealth infections. You deserve more than symptom management. Stop chasing symptoms. Let's get strategic about what your body is asking for. So want to make sure that this is the right fit for you, right? I want this to work for you, not just feel like another step in the dark. You're not sure about it. And so we start by understanding your symptoms, your story, and your goals together. And the way that we do this is with a fit and focus survey. So, I mean, transparently, the truth is my approach isn't right for every person. It truly isn't, right? There's going to be scenarios where it's like, I don't know if my approach is the right one. So for instance, if you don't have many problems, like you're more of a wellness patient, you just want to be optimized, you don't have a whole lot going on, my approach is not the approach for you, right? So things like that we want to make sure that this is going to be the right fit for you. And so this survey helps us to understand your case and make sure that we can help you, right? That this is going to be a good fit for you. And so my team is going to make sure that you have access to this survey, I believe in the chat, and I think they're going to maybe even email or text the survey to you. And so this really is the first step in determining, like, is this even the right fit for you and what you're dealing with. And if you are a match, you'll be invited to schedule a free discovery call with our team. You'll be talking to Mark, and Mark is incredible at answering questions, also determining if this is going to be the right fit for you. And it's focused, it's personalized review. It's not a sales pitch. Again, we're not in the business of doing that. We want to help people, right? We want to make sure it's the right fit. We want to make sure you're informed. We want to make sure you feel good about it. And so that's what that call is about, is answering all of your questions. And then if you do want to move forward, if you want to go to that next step, which is going to be making an appointment with me, then you would have the opportunity to do that on that call. So let's figure out what's really going on. So take the first step and start your fit and focus survey today.